Department of Health is looking to review the current dispensation for employment of doctors, especially medical officers and specialists. This is according to Health Minister Joe Phaahla, who was reacting to complaints by several young health professionals, especially medical doctors, who completed statutory community service programs but are now struggling to find employment. Phaahla says the intention is to check if there are areas where existing monies can be reassigned to enable the employment of more health professionals in public health facilities. But for more on the matter, we are now joined by the Deputy Health Minister, Dr. Sibongiseni Dhlomo, to talk to us about this. Deputy Minister, good to have you, and thanks so much for joining us.
Good morning, Leanne, and good morning to the Morning Live viewers.
So this is a headline that's been doing the rounds for quite some time, and it's good that the Minister did address it. But let's ask it directly. Why is there such a large number of unemployed doctors who have completed all of their statutory community service programs and yet can't find a job? What's going on?
Leanne, thank you very much. For some of us who have always been health activists throughout our lives, we realized then, 10 years ago, that if we do not produce enough of the doctors, the situation of expansion of the society and all the disease burden coming up will catch up with us. So the plea to the universities was to please expand their intake. And we also know that there is also another program going on, the Cuban Fidel Castro model, which also expanded that process. Instead of sending 80 students, we started in 2012 sending about 1,000 of those. Now, we were not saying we will have enough of the resources when they come back, but we're saying as health activists, let's train enough. Little did we know that there will be these economic challenges where we now would want to have all our doctors. So it starts with us having really had a vision to expand and really make sure that at least every facility, including a clinic, will have a visiting doctor or a permanent doctor there, because we now know that if you have doctors all over, you then minimize the heavy burden of disease coming too late to our hospitals. So now it is catching up with these fiscal challenges that we have in the country, because we are also asking for the same budget within the space where there is demand for building up of bridges across that river for people to go across, providing clean and safe water for the citizens. So all our requests are coming in there, but there has been a desire, and it happened last year for some few months, where even the president intervened to say, please, even if you are going to top slice departments, top slice Department of Health and Health less, education and health less, because they are really dealing with the very critical services. So we are at that balance, and that's why if we can't get more, then the minister is now looking inwardly. What else can we do, maybe inwardly? And I think I could also share those with you to expand on what the minister was looking into.
And certainly inwardly is something that really does need to be addressed, because as much as there are challenges of the fact that there are doctors that are perhaps sitting at home that are there ready to go and apply their service into the medical sector. They can't get it because of the lack of funding, number one. We saw that the minister yesterday was saying rather let them become GPs, open up their own private practices, as opposed to leaving the country to still try and keep their skills here. But these are doctors that would love to go into some of the fields where there's a desperate need for doctors, because there are too few doctors servicing far too many people. So, Deputy Minister, how do we get around this? Because it is bad for hospitals, it's bad for South Africans, and it's bad for those that have studied for all these years and can't find jobs.
Before I give you that, Leanne, which is bad for our country and bad for the hospitals, you know, you don't even know what comes first, the chicken or an egg. Yeah. Let me give you this scenario. Because if you have fewer doctors in hospitals overworked, you are likely to experience some misdemeanors, mistakes, and therefore you shoot so high in terms of medical litigations. In fact, the minister quoted even this, that is one province, maybe for now, so that you don't really become focused on that province. One province last year paid 900 million rand on medical legal claims. And that amount of money, Leanne, could hire as many as over 1,000 of these doctors. So if you do not deal with the medical legal claims and have plans how to reduce that, among other things, to reduce it is to improve the equipment, improve the number of healthcare workers in the space, retrain them, get them to be going through fire drills. We're not going to make a success story. But let me leave that now and come to what are the things that Minister was maybe alluding to. Among other things, Leanne, in the dawn of our democracy in South Africa, there were certain hospitals and areas which were actually declared as very dangerous to work at, and having to sacrifice if you go there. And therefore, those hospitals and districts qualified for what we call a rural allowance. A rural allowance was meant to really cushion and make sure we attract doctors as an incentive to get there. I can give you 2 hospitals because I have worked in that province for long. Prince Msheni Memorial Hospital, the hospital at Mlazi, an urban area right now, not really rural. The second one is Itindale Hospital, now called Harry Gwala Hospital in Itindale, Pietermaritzburg. Those 2 hospitals and many others in the country qualified for a rural allowance. If you could quantify that or remove it, 2 doctors getting a rural allowance can actually give you another 1 additional doctor to really work. So those are discussions that you can't get overnightly, and you need to discuss and engage union to say, now the society is not static. Those communities were once engulfed by political violence, turmoil, and that is no more there. And therefore, they qualified on the basis of a rural allowance because there were situations that we would want to actually attract doctors to go there. Now, it is stable. So why don't we remove the rural allowance and allow them to have more entry into the system?
Yeah.
So Minister, among other things, alluding to those things.
One would think, and I mean, this is the reality of the whole system, is that there's so many factors that are forcing doctors to either not get employment, and if they can't get employment, to try and find a way to get employment elsewhere in other English-speaking countries that they can put their trade to good use. But many are speaking to those issues. Some of the issues that you mentioned, I mean, that amount of money of legal fees is unbelievable. But also talking to the conditions that they work in, the lack of medical equipment, the lack of medicine, the lack of services that are brought about. And of course, these are things that have been spoken about for many, many years. And I respect you saying that, you know, this can't change overnight, but this isn't an overnight conversation. It's a conversation that's been held for a very long time. I'm reading just one article where it's saying that the Canadian immigration consultancy that looks for jobs for South Africans overseas have noted that the offices received about 17,000 inquiries from South Africans for looking for jobs abroad. This must be very worrying, and obviously this is on a medical article, so this contains a high number of medical doctors looking elsewhere to work in the field.
Yeah, I see a footnote there in your screen, Leanne, talking about 1,000. We do not have those numbers reconciling. We just had on this, just to make that point, we were reporting yesterday that there's got 564 medical officers post-community service that have been employed. We are currently advertising 240 spaces for more of them to come through, and we are still looking for resources to get another 275. Discussions are going on with the minister to get more, if we could, with the Minister of Finance. So the 1,000 is the numbers that Samatu always talks about, which we don't. But this is we don't issue about numbers here. Let's just agree on a principle that even if 2 doctors that are not employed, some of them are coming in from the most deprived communities and families. They need to be supporting their families. Some of them already have got certain obligations that they've got themselves into. So we are working hard to turn around the situation, Leanne. We will continue updating you on those measures. But we are actually saying, yes, some of us are sympathetic. It's not easy for a doctor sometimes to make a big loan to go and open a private practice. But some of them, therefore, the departments in provinces have written to them to say, look, you are a bursary holder. We are relieving you from this obligation because we are still short. We cannot keep them waiting for so long and not make decisions. Those decisions may not be favorable for the doctors, but let's just give them some way and indicate that if there could be some way of relieving them from the system, let's do so.
So I see numbers. I know it's a matter of semantics, and it doesn't matter, what the number is, but the reality is that there is a number. But the number that the South African Medical Association and its trade union counterpart submitted, and they had actual names that they submitted of 825 doctors to the Department of Health, saying that they're looking for work and they just can't find the job. And that's what they are saying. But you're saying it's far less according to your systems. Is that correct? I mean, I think it's important that we do clear that. So you're saying that that is not the number?
Yeah, according to the information that one received from our Deputy Director General, Dr. Mahlat, who's dealing with this matter on a daily basis, some of the applications and the names, when he was asking them to forward them to him, were some of the doctors who are currently not completed their computer service yet. Maybe they are already panicking, sending their names and saying, look, I'm looking for a job. But so those genuinely who are there in the system, who have completed, and we have not placed them. But that number, according to the Mahlat, is also inflated by those who are still to finish, some of them this month or next month or in April. That is why maybe the 375 that I've indicated may cushion us there. The 240 that the Minister announced yesterday is available as of today in terms of applications and sorting them out countrywide. So it is like a work in progress, Leanne. We are not really shutting ourselves out. We were the ones who created this situation where we need to have more doctors, but now the fiscus is challenging us in terms of, now that we have got more doctors, we are really constrained in terms of placing them there. So we are with them in terms of their thinking. It's just that in terms of the country situation, we are also navigating that together with all the other departments.
Deputy Minister, let me ask you this as well, because obviously we get to a point where, you have your doctors that have successfully completed the statutory community service. And then there's the very far outlying hospitals, and perhaps they are requiring the skills that are needed. Do you find, and perhaps we can't ignore this as a cause for concern, do you find that doctors don't necessarily want to take those positions that are on offer in, the more outflung areas, the outlying areas, in rural areas, in hospitals that perhaps are not in the cities, or not necessarily where they want to be working, and they refuse to take those jobs? Let's look at that side of the story as well. Do you find that this happens as well?
No, Leanne. The current crop of doctors who have qualified, and a significant number of them who have already trained in the rural communities and hospitals and the model, and a big number coming in from Cuba, they really love to work in the districts, in the most rural hospitals. It is not that, you are correct, we may still have that far-flung district rural hospital without a doctor, because maybe we are thinking, let's keep this money and improve that for that building that is falling apart in terms of infrastructure, and maybe we haven't had this X-ray machine fixed for a particular long period. Why don't we buy a new X-ray machine and forego getting an additional nurse, doctor? And so those are compelling, those are all the pressures that maybe at that level is being, so that post remains open. We're not filling it up because there are other pressures. But let me just be honest with them. None of them are unwilling to go and work in the most rural deprived communities. They are willing to be available to go there.
Well, that's good to hear, Deputy Minister, but I do hope that we get to the bottom of this, because the fact that we have unemployed doctors sitting at home is a crime on another level, when South Africans are desperate for good medical care and the positions are available. Deputy Minister, I've got to let you go, unfortunately, but we will do a follow-up on this. May I just ask you to confirm about those cholera cases? Are they in fact confirmed from the Health Department? I know it's a different conversation, but they were saying that there are 4 cases of cholera in Limpopo and another case at the Helen Joseph Hospital. Have they been confirmed according to the department?
Yes, Leanne, they have been confirmed. We're just tracing back and see where they come from. What are the sources? Is it outside the country, or was it inside South Africa where they initiated? Yes, ma'am.
Okay. All right. Deputy Minister, thank you for confirming that for us. That was our Minister speaking to us about the jobs available, doctors that are unemployed and at home and seeking opportunities elsewhere.